Podium mic check. Podium mic check. Are we all good? Wireless mic 1, check. Wireless mic 1. Wireless mic 2, check. Wireless mic 2.
Line unmuted.
Good afternoon, and thanks so much for tuning in. Wanted to share with you a brief update as some local communities across our state consider further measures as positive cases of COVID-19 continue to rise, and our healthcare workers continue to ask that every Montanan do their part to get their hands around this virus. Last week, Yellowstone County hit nearly 62 cases per 100,000. Placing Billings as the 18th highest in cases in metro areas among the United States. Healthcare workers in the Billings area understand that this virus needs to be taken seriously now before it's too late. These healthcare workers not only provide care to those within the community, they welcome in patients from the larger surrounding areas, including neighboring rural and tribal communities. Local public health has set a goal of bringing the rate to below 40 cases per 100,000 in Yellowstone County. And to help reach this goal, they put in place additional measures that will go into effect tomorrow. And these additional measures are certainly critically important. We know that large social gatherings continue to be the biggest threat to our ability to get our hands around this virus. Large crowds not only increase the likelihood that someone has the virus and will pass it on to others, it also makes the contact tracing work of local public health that much more difficult. The fewer the people, the less likelihood of contracting the virus. And the fewer people, the greater likelihood that local health can actually contact trace, test close contacts, and quarantine and isolate. Yellowstone County's new health officer order limits gatherings to 25 individuals without regard to social distancing and without regard to being inside or outside. Certainly ask members of the community to take this seriously. Reducing crowd size for a short amount of time will make an immense difference in the long run. It'll ensure that we'll get to a time where we can see that live music or host that reunion or wedding with family and friends we've been looking forward to. But it'll also do much more than just that right now in the short term. By focusing on limiting size gatherings in Yellowstone County and reducing the spread, our businesses certainly have that much better shot at staying open. Our kids have that greater likelihood of maintaining their education in their classrooms. No one certainly wants to see their favorite brewery closed their doors. No one wants to have to see their neighbor unable to work because their child can't be in school. Additionally, yesterday, the Flathead City County Health Department announced it'll consider a proposal later this week to outline further measures to take if their caseloads do not slow down. The Hill County Health Board is currently asking for input on what measures they should be taking after they've been setting new records in cases over the past week. And many of our tribal communities are currently under stay-at-home orders or other phase-back approaches. As Montanans, we should all have the shared goal of supporting the work of local public health officers, doctors, and nurses on the ground. The quicker we do so, the quicker that we can get our hands around this virus and resume that new normal. Avoiding large gatherings, masking up in public spaces, washing your hands regularly, disinfecting, staying home when sick, and quarantining when you're asked to do so. These are measures that by design, where we just have to make relatively small sacrifices, but allow us to resume our lives to the best of our ability with the virus still in our midst. And they're measures that could prevent businesses from having to close down, measures that could prevent schools from having to close for a longer duration. And importantly, these measures will protect our doctors and nurses who are working day in and day out to care for COVID-19 patients, in addition to the many others that walk through their doors seeking care. Hospitals in some areas of our state are reaching or are already at capacity due to the influx of COVID-19 cases in recent weeks. We should all be concerned if we see a time where hospitals become too full to care for those who require care. We've seen that almost hit in other places like Florida and Texas this summer. And as hospitals' needs surpass capacity, the businesses had to close down. Montana is not immune to this reality, just as we're not immune to this virus. It should be noted also that Montana is not alone in seeing an increase of cases. 31 states across the country have reported more COVID-19 cases this past week compared to the week previous. We can't do anything about the rest of the nation, but we can always do more here at home. As governor, I've implemented directives that set a statewide baseline on the measured response we should be taking to curb the spread of the virus, and these remain in effect. Restrictions are still in place for bars, restaurants, crowd gatherings, and more. Health officers in many counties have taken additional steps as permitted by law that meet the needs of their communities. Thinking in part, I was asked last week's press avail if local public health officers or locally elected officials had asked me to put back in place stricter measures than what we have now. And they have not. I have been asked from local public health officers, however, how we can ensure that the state and local measures currently in place can actually be enforced. I've heard from a wide cross-section of Montana, from compliant businesses to the head of a local chamber of commerce, that compliance with the restrictions, it's lax in some areas. And because of that, enforcement of the orders is also wanting. Montana's public health laws anticipate the kind of crisis that we're facing in our state. These laws permit state and local health officials to issue orders that address the spread of communicable diseases. The same law empowers county attorneys then to enforce public health orders. I think we can only be successful in beating this virus if we all work together as a team. And our local public health officers certainly need all of us to be on a team right now. Now more than ever, we need to roll up our sleeves, get our hands around this virus. I have consulted with several counties engaged in enforcement about their processes. These counties have found that a vast majority of compliance issues are resolved by the health department conducting an informal call or visit, and an industry-specific inspection occurs. And the lion's share is resolved if the health department provides education to the establishment owner if the compliance issue persists, or if the business continues to not comply thereafter and the health department issues a health officer order. In rare circumstances where a compliance order is not followed, health departments can refer to county attorneys to pursue civil enforcement action. Counties have observed that by following the process through to its conclusion for the most egregious bad actors, they've been able to create a substantial community deterrent. In normal times, officers certainly can't issue speeding tickets for every speeding violation that occurs on the road. But if drivers know that there are no officers on patrol, they can certainly speed with impunity. Likewise, there's no expectation that every single violation of a health order will be or should be remedied through enforcement. But our public health officials will find themselves helpless to combat the virus if they don't receive the support that Montana law guarantees them. It's worth noting that among large counties, those that have taken civil enforcement action against some of the most egregious bad actors currently experience much lower rates of transmission. A strong deterrent benefit after only a few more visible enforcement actions. My administration is offering support to county attorneys by providing education on the process and, if requested, also making state legal resources available for consultation. Additionally, in understanding that this really is a challenging time with a new list of issues to navigate from COVID-19 on top of the day-to-day responsibilities, we'll also work with counties on making available relief dollars to help increase capacity to investigate and enforce violations of health orders. If we all work together in good faith, I do believe that we can better get our hands around this. And importantly, we can prevent our Main Street businesses and schools from having to shutter. But only really if we roll up our sleeves and work together. I'll be holding another press avail later on this week to provide further updates on COVID-19, but also should note that I do have Dr. Holzman, the state's chief medical officer, here with me today, as well as Jim Murphy, the head of the Infectious Disease Bureau, if you have any questions. First phone question.
Hi, Governor Bullock. This is Marisa with NBC Montana. And concerning recent hospital capacities being made public, the latest White House report on Montana says communities should implement hospital expansion plans where needed, and they specifically mentioned Yellowstone and Lewis and Clark counties, but we know based on those daily updates, several more counties are nearing capacity or at capacity. I'm wondering if there are plans right now to open any additional field hospitals.
Go ahead, Doc Holzman. Go ahead, hop up.
Each of the larger PPS hospitals, the larger hospitals, we're speaking every morning, Monday through Friday, and going through things. Each of the hospitals have their own surge capacity and plans. In fact, one of the issues about some of the data that's going out is, do we use the surge capacity of those hospitals or the staff beds? We're going to be consistent in using staff beds for that. But these are continued conversations. As you know from earlier in the spring, we've talked about different resources that we could open up if necessary. Some of those will take more time than others, and we do need to look at staffing. So it's going to have to be an all-community response. At this time, discussions are continuing.
And if I could follow up on that, Dr. Holtzman, I've also heard there's an issue not even so much for beds as there's staffing, and that there's a significant amount of care workers, even in Missoula County, under quarantine because of community spread of COVID-19. Are you seeing that statewide, and what can be done to help that?
Yeah, there's definitely that issue that there are hospitals that are having issues with staffing. They have notified us at the state. It is a challenge that's very difficult because many other states, like our colleagues in North Dakota and South Dakota, are having some of the exact same issues. So the pool becomes smaller to get those resources. One of the things that the hospitals are doing really well and continuing to do is making sure that the individuals while in the hospital are doing all the right protocols, so they're wearing the right PPE and others to prevent picking up infections there, and also asking their employees to be very conscientious of what they're doing outside of work to decrease their risk of picking up the virus elsewhere. We do have limited staff, and we are concerned if a large swath of people have to quarantine. We do have abilities to do work quarantine, but that's not ideal, and we'd rather people stay healthy.
Next phone question.
Hey, Governor, this is Holly Michaels. How are you doing?
Welcome back, Holly.
Thanks. Glad to be back. I'm wondering if you could talk a little more about, you mentioned making state legal resources available. Who would they be available? What would that resource be, I guess? And then who would they be available to? Would it be county attorneys, or I guess kind of talk if you could talk a little bit more about what that would look like.
Sure. A couple different areas, Holly, is that, the challenges, I think, for local health and county attorneys are often capacity, right? That if a local public health office is doing so much contact tracing and so much of the work, that whether they have the full capacity to follow up on complaints of non-compliant businesses, as an example, could well drop down to a lesser and lower priority. So we are going to, afford, reaching out to say, be it either from an inspector perspective, meaning that either sanitarians or folks in local public health, if there are additional needs at the county levels, that will provide state resources to help fill those needs. That could be anything from additional hours for overtime to also, the potential for either our hiring contract workers. But then the second part of that is also, I think, some of the times the challenges are, and there are different ways, right, that you can enforce both the local and the state directives. And there's been some real concern, well, you'd be criminalizing behavior. What we've seen in many communities, Missoula is like a great example, is what they've been doing is civil enforcement actions along the way. And want to make sure two things happen, one of which is I recognize also that pandemic doesn't make crime and every other challenge go away. So I've heard from sort of secondary sources that in some county attorneys' offices that, really taking on supporting those public health orders, bringing compliance actions are much, much lower priority. So at the state level, we can do two different things. One of which is that we can provide those county attorneys' offices basically the templates of what you need to do. And we gather that from some of the other communities like Butte, Silverbow, and Missoula, and to a degree Lewis and Clark as well, that have had a number of these enforcement actions. And then the other, so both providing sort of the background templates, helping make the connections, and in those areas with high community spread, then also if the concern in the county attorney's office is that they don't have enough actual lawyer time, well then we're happy to use CARES dollars to help augment or supplement the work they're doing if that's what it's going to take to actually get these directives complied with and the local public health orders complied with.
And then, do you know, is there any information, and it's probably pretty hard to get at, but percent of cases that come from issues of non-compliance versus like household spread or that sort of thing? Just trying to get an idea of people not complying and how much that's leading to spread versus things that are kind of unavoidable or schools or stuff like that.
I'll give it to Jim Murphy.
When local health departments look into the cases that are reported, they try to determine what the setting is where spread might have occurred. And most of our cases are coming directly from household contacts, close contacts in other sectors. But they do look at, what kind of events might be associated with the spread. There have been instances where we have had large gatherings where they're clearly over capacity or not following masking directives, where we have documented transmission. That's not uncommon. Some of these are social events that have been associated with sports teams that happen afterwards, where capacity requirements of restaurants and bars may not exactly be followed, as masking guidelines are not followed either. So it's kind of hard to tease all of this out, but we do have some instances that we have enough data, enough cases that report a transmission event or a risk that makes us be able to put our finger on, this happened at, like, for instance, a large wedding, where we know that over 30 plus cases have been associated with that. And we know that they did not follow the guidelines that were given to them by the local health departments when they approved that event. So we do have some instances where we definitely can document it.
Thank you.
Next question.
Hi, this is Phil Drake from Great Falls Tribune.
Hi, Phil.
And sir, how are you?
Good.
Was just wondering, just sort of a follow-up on what Mr. Murray just said. Is the fact that you're testing a lot more, and I guess maybe that this is a dumb question, but is the fact you're testing a lot more producing a lot more cases? And, you know, are the causes still the congregate settings, or, you know, I just was trying to get more in depth on what's causing this this spike in the number of cases.
Well, we are definitely testing a lot more, and if you test more, you will find more cases. But I think the more important thing here is to recognize who we're testing. We're not doing a lot of community testing of people without signs and symptoms. We're testing mostly the people that would be the ones really important to test. These are close contacts that are identified as part of an investigation. So these are the people most at risk. Our priority testing is still looking at close contacts, symptomatic individuals, and then certain congregate settings. So I think the point I'm trying to make is that if you look at who we're testing, these are the people that you would expect to find positives because they're most at risk. It's because they're linked to cases. So I don't think that we're getting more numbers because we're just doing more testing randomly. We're testing the right people, but it's because they have exposures, and those are the exposures we're trying to prevent.
Thank you.
Governor Jessica Watts with ABC Fox Montana. Obviously, there's been multiple outbreaks in detention centers across the state. So kind of what do those numbers look like right now? Have they increased and decreased? And what is being done at the state level to combat those cases?
Do you know the numbers on detention centers right now, Jim?
So detention centers can be a particular challenge because of the ultimate congregate setting, and then staff members that come and go can bring the infection into a detention center. Inmates get transferred around. That can also bring it into a detention center. Once it gets in there, it's easy for it to run a little bit rampant. So right now we're battling some outbreaks. We have a large outbreak going at the Crossroads Correctional Center in Toole County. That's probably the most noticeable or noted one on the state level. The Department of Corrections is working closely with folks at the Department of Public Health and Human Services on that to track what's going on, to offer testing services and a lot of consultation as we try to help Crossroads respond to that. We have a limited number of cases popping up in other congregate settings. That includes some small activity in county facilities, as well as a little bit of limited activity at the Montana State Prison. Hopefully, in those places, we can get ahead of it before it gets too far along to kind of interrupt things. But these are challenges in those settings. There's only so many things you can do to separate ill from well people. So they present particular challenges.
Next phone question.
Hi, Governor. This is Iris Samuels with the Associated Press.
Hi, Iris.
Hi. My question is about, I actually have a couple questions. My first is about the CARES Act funding. I'm curious if you have a set dollar amount that you've set aside for this enforcement effort, or if this is just kind of on a need basis.
We don't have a specific set aside through this. Like through the end of the year, we've committed $300 million to local government. So actually spoke to the county, the Association of County Organizations and the League of Cities and Towns, saying that what we're looking at right now, absent additional CARES dollars coming in, is using some of that money, which is based on reimbursements, that's why, and it'll go all the way till the end of the year, for directly this. And then we will be reaching out to, in some of the higher areas of concentration, those county attorneys' offices, of saying, this is available, we'd be happy to partner with you, and the same will be done with local public health.
Okay, my second question is about, you mentioned that some counties have done enforcement well, so I'm curious if you could name some counties that you've been in touch with that you think have done this enforcement well, and if you've kind of pinpointed some counties that need additional help with enforcement.
Well, I think as but examples, Missoula County has done it well. In as much as, look, enforcement isn't going to keep, any cases from being in the county, but it's been a coordinated effort with both the Public Health Department, the County Commission supporting the Public Health Department, the County Attorney's Office, and law enforcement when necessary. And I don't think Missoula is unique in that respect. I think Lewis and Clark County has done a good job. I think Butte Silverbow, as an example, are three areas where they've had the support, their local public health has, I think, had the support of their county attorneys along the way. So where I want to underscore the challenges is first making sure that everybody understands that this isn't going to take, 3 lawyers and paralegals full-time efforts. So I'm not pointing fingers at other counties that aren't doing as well, but saying that in a resource constraint environment, those areas with significant community spread, those areas where the numbers are that much more concerning, that if there are additional resources that might assist them along the way in actually making sure that public health orders are followed, that we want to partner in every single way we can to make sure that they have those resources.
From Montana Television Network. You had mentioned in, for example, Yellowstone County, I think you said 60 something out of 100,000 per, and trying to get it down to 40. Is there some specific levels that you at the state level are looking at that has you concerned about an area being above this, or is it more of a week-to-week thing, or?
Well, yeah, and I'll let either Jim or Dr. Holzman speak about it. Like the metrics that Yellowstone County Public Health put out was that they wanted to be at, I think, 40 per 100, and if not, that they were going to put in greater restrictions at the end of this month. Knowing that everything that we do and see today, as an example, it's not just a product of today, right? That this is sort of over the last couple of weeks. And when it hit to that point of 60 per 100,000, that's where then they said, no, we can't wait until the end of the month. We have to take some actions. Do you guys want to give a little bit more of a higher level or aggregate?
I think that quantitative data is really important for us to stop and look at things. But we also need to look at the qualitative data of what's going on there. So we might see numbers that look extremely high in a small county because of a few people and a small denominator. We might see a high number in a county, but we know that it's all coming from a detention center. And so you won't respond to the whole county in that way. But I do think these numbers, which our local public health officers, whether you're in Yellowstone, Missoula, or any place else, are constantly looking at, is one of the pieces of data that's going on. And it doesn't matter what county you're in, these local public health are just working like crazy, some with more support than others, but I just want to put it out there again. They're looking at this data and they're trying to go forward. considering I have the microphone, which is not nice, I just wanted to go back to answer one thing from Holly, if I could, too. We said this a few weeks ago, that we have such an advantage living in Montana that we can learn from what's happened in so many other places, whether it be at Texas or Arizona or others, and we don't need to wait for things to come here. And we're in that same situation again, and the reason I just bring this up is an MMWR report, which is out of the CDC, the Morbidity and Mortality Report that came out on October 9th, talks about, and I'll just read a quote specifically from them, the number of COVID cases in Arizona stabilized and then decreased after sustained implementation and enforcement of statewide and locally enhanced mitigation measures, beginning approximately 2 weeks after implementation and enforcement of these mask mandates and enhanced sanitation practices that began on June 17th. Further decreases were observed during July 13th to August 7th after statewide limitations and closure of certain services and businesses. We have the data. We don't really need to wait and see it happen here and then respond. Let's learn from those around us.
We all set? Well, thank you very much for participating, and we will plan on probably providing another update later on in this week. Thanks.